Hey, before we get started, I want to tell you about something that's changing the game for women in dental leadership. It's called the Empowered Leadership Experience for Women in Dental. It's a 6-month transformational journey for women who are done with burnout, overfunctioning, and trying to lead like someone they're not. This isn't just another leadership training, it's a coming home to your voice, your power, and your joy. If you've ever felt alone at the top or stuck somewhere in the middle, this one's for you. Enrollment is now open. Head to leadhershipexperience.com to enroll. Because real leadership isn't about performing, it's about remembering who you are. Now, let's get into today's episode. Joanne Ignatov is a dental assistant in Canada, just outside of Toronto. I'm so excited to have her on because she is the first dental assistant I have had on the podcast, and she is a huge advocate for dental assistants to live the lives that they love and feel seen and valued and appreciated. She practiced as a dental assistant for decades, then navigated on to become a teacher, where she then taught and inspired young dental assistants from all over the world. Now she runs a coaching company helping dental assistants really feel seen and valued in a sense of community. She talks a lot about her experiences, and we also talk about the spoken, sort of assumed thing that we all know happens in the dental space, which is that dental assistants are often the last ones to be recognized, often overlooked, taken advantage of at times, and there can be a lot of ambiguity as far as expectations of what dental assistants are responsible for. So we shed some light on that, and we give love to our dental assistants. And just as a little technicality, in Canada, they are called level 2 dental assistants, which in the US, it is the expanded function dental assistant. So when she refers to level 2, that's what she means. And I'm really grateful to have her on and have her advocate for some of the unspoken heroes in dentistry. Joanne, welcome to the Real Talk of Dental. I'm so excited to have you on. You are my very first dental assistant that we've had on the podcast, so this is really exciting. So shout out to all the dental assistants out there. And I am really grateful for our conversation we're going to have today because you're just such an incredible representation of what's possible, and you are an incredible advocate for dental assistants. So let's dive in.
Thank you. I'm so excited, and I'm the first one. That's awesome.
Yeah. So tell me a bit about where the passion comes from in advocating for dental assistants.
Something I always knew was that I wanted to get into the health field somehow, some way, and fitness. So combining those two in a however that worked out. But I had an opportunity to finally get into the dental field, and I did. So I started dental assisting, and this was years ago, almost 30 years ago. And starting my program, it was only a 6-month program back then, and I'm just outside Toronto. So when I took the course years ago, it wasn't level 2 combined the way it works now. It was level 1, and then you go back and you take level 2. So I started my program. It was only 6 months. Getting into that program, a couple months in, a little background was my mother had been sick. She had MS, and she had been in the hospital for close to 9 years. And about 2 weeks into my program, she had passed away. So, that was something that was really challenging because it was, do I continue on or do I quit? And there was no option for me to quit. I was basically just on my own, trying to figure out which direction to go. So I stayed in the program, thank God, and graduated 6 months later. And the whole time that I had lived with my grandparents while my mom was sick. So her parents. After graduation, at the end of October, my grandfather had passed away, who was my father figure. So at the beginning of the program, I lost my mom. At the end of my program, a couple months later, I lost my grandfather, who was my father figure. And there was something, over the years, I went on and I upgraded the skills as they started to come out for us as dental assistants. And I always wanted to be on top of what the skills that were being offered to us as dental assistants, because I wanted to be able to do everything. And, it was something where I wanted to keep going. So eventually, when I, finally upgraded all of my skills to the point where I couldn't go any further, it was just something that I was proud of myself for coming as far as I could. And when I did get into teaching, which wasn't that long ago, it was almost 8 years ago now, it was something that I always used for my students, because I had a lot of students that came from other countries to the programs, and they had tough lives, right? And so, I think sometimes, people look at you and go, oh, well, you have this, you have that. And I'm like, no, I don't. There's always struggles. People always have their stuff that they have to deal with. And so I used my example, that I could have quit because my mom passed away. I could have, not gone on, or, been held back, because at the end of all of that, I lost my grandfather, who was my father figure. But I continued on. And I'll never forget, I had one student, she was so cute. She wanted to quit so bad, and she had this trauma that had happened to her in her life. And I said, listen, I'm here to help you every step of the way. And I did, and to this day, she still messages me and says, "Thank you, miss." Like, I'm like, "Don't call me miss anymore." Like, we're on the same level here. So, there was always those examples that I used from my own life, because nothing's perfect. Everybody has stuff to deal with. And, just using life experience and going through all the years that I experienced in the dental field, I would always try and make it relatable to them, or use examples that, like I said, that they could basically just relate to and learn from, and go, okay, you know what? Everybody's going to struggle or deal with something, and it's how you get through it to get to your end goal, and right in the end. So there's always got to be a goal and the reason why you're here. And that was another question. I always said, what's your reason for being here? And so that was it. At the beginning of those courses or those classes, that's what I always did. It was, why are you here? Because they were here for a reason. They wanted to do better for their families. They wanted to make a living, right? And start fresh in a new country. And I did have a lot of foreign trained dentists who came here, and I always made it so that we're always on the same level. They have different experiences because they were actually working on patients. So I said, hey, listen, if you're able to explain something to the class in a way that might help them, go ahead. I'm not here to go, oh, I'm the best. I know everything, because no, I don't know everything. We all know that this field is always changing and always evolving. There's always something new coming out, or somebody has a different experience. Why not share it with somebody else? So, yeah, right? Like, I'm not better than you. And just because I'm standing up here in front of the class, I never thought I was better than anybody. I have experiences to share, maybe more than others. But if you have an experience in the field somewhere along the way, share it. And that's what I always did, or help somebody. If you can explain something to somebody in a way that's going to help them learn better, why not use it, utilize it, right? That was always my goal. Everybody's here to help everybody. It's not just me. We can all learn from each other. So, yeah.
Yeah, and I love your advocacy too, because, it's pretty well known in the dental industry, right, that dental assistants can often be taken advantage of, exploited, not quote unquote valued as much as other team members. There's also a lot of struggles with dental assistants as far as clear expectations, and I guess clear expectations, and then also what the expectations are. They tend to be pretty excessive at times. Then assistants really finding their balance as a team. I know a lot of dental assisting teams can really struggle on who's carrying the weight, so to speak. Some assistants tend to do more than others, and they can almost become their own worst enemies within the teams themselves. And I know you've seen and experienced a lot of that. And something you're really passionate about is ensuring that dental assistants really know their value and their worth in the practice, but also making sure that the leaders and other team members really understand what dental assistants bring to the plate as well. And so do you want to share a little bit about that too, and your journey and how you advocate for that within the dental assistant community?
So, everything you said is 100% what is going on. Like, dental assistants are often overlooked and undervalued. And I can't say it's happens everywhere, but it happens more often than not. So it's really helping dental assistants to realize their full potential when they're out in the field, and, you know, getting them to utilize as much of their skills as they can. Because I think what other team members need to understand is dental assistants are way more capable of just sterilizing and, sitting chairside assisting the dentist. They can jump in and utilize those level two skills that they have to help make things run more efficiently within your practices. And it could be just the simple things like jumping in to polish something, jumping in to throw on a rubber dam while the doctor goes and does a check. Um, Giving some oral hygiene instruction to a patient so that, whether it's a hygienist or the dentist can move on to the next patient and then you can dismiss. So I don't think that every dental assistant is being utilized to their full capacity and they're just being utilized to sterilize, bring in patients, seat them, and then assist. I think the overall, what I want to really get across is if you utilize your assistants to their full capacities, a lot of offices are talking about numbers and all these metrics to meet end goals for the month. And I get that. That has to happen in order to run a practice because there's bills to pay, there's staff to pay, there's all of that. But throwing in these areas where a dental assistant can jump in can actually help increase productivity within your practices as well, because it's being more efficient overall. Because I can jump in, I can do this, you're moving on to the next patient. Why not do that? Why not utilize those assistants to their full potential? Why not let them show the value that they can contribute to your practices? Because they can. And believe it or not, it will make a difference in the end, in those end goals, even if it's you're off your numbers by a couple $100, let's say. What if that couple $100 was me stepping in to help polish, to put on a rubber dam, to give oral hygiene instruction, to put on a matrix band, to do those little things where you can save time so that maybe hygiene can move on quicker because you've got your check done. They can bring their next patient faster. You can schedule more people in their columns. It's all of that put together. And I think that that often gets overlooked. This is where my passion comes in. I'm like, I believe that we can just do so much more within a practice than what people are allowing for or doctors are allowing for. There are other reasons on top of that, but again, think about it. You want to meet these numbers, you want to meet these goals. You know what? I'm here to help. And that's all I want to do. I'm here for the patients. Number one, they're your priority. So sitting down with them, making them feel comfortable, making them feel welcome within the practice. Because again, that's something, as soon as the doctor gets up to leave, when let's say treatment was recommended, who are they going to look to as soon as you leave the room or the op? Me. And they're going to go, do I really need this? I can't tell you how many times that's happened. And I'm like, yes, 100%. And then comes along with that, being able to back up the doctor and really get the patient to understand the reasons why what was recommended to them is actually needed. Because there's the saying, and it's so true, is that your oral health affects your overall health. And that's something that people don't always get, because can you see in your mouth all the time? No. But can I see a scratch on my skin and go, oh my God, it's infected? Yes. Can I see that in my mouth or on my, with my tissues, my gums? Not necessarily. Would I know what to look for as somebody who's not in the field? No. But being able to explain that to a patient, that can make the difference between accepting, treatment or not, right? So again, this is where I feel dental assistants just bring so much value and so much more than what is being recognized out there in our profession. So this is where I'm here to help dental assistants and practices really go, okay, where can we fit this all in a day? What type of extra training would your assistants need in order to feel comfortable, competent to be able to do all of this, right? They need to feel that confidence. But again, it comes with repetition sometimes too. If you're not doing stuff all the time, you're not always going to feel comfortable doing it. But it's allowing them to be able to do these things that's going to help them gain that confidence they need to help your patients and help your practice overall. And that's what I'm here to do. For teaching for almost 7 years and working in the clinical side of things for 21 years, and now doing what I'm doing as far as working with the Dental Assisting Collective, this is where I'm at, because I feel this is something that dental assistants really need. And I think it's something that's not really out there right now. It's not, so some people might look at it and go, "Oh, what does she think she's doing?" And I'm like, what I'm doing is wanting to help dental assistants. I'm here to help show them that they contribute more value than what they may be shown within a practice, or what they might, how would you say, feel, or being recognized. And again, it's not always about recognition, but it's about the value that you can contribute as a staff member to the practice for your patients.
Yeah, I love that. And I love that you're advocating for the assistant community, because there isn't as much, there isn't a whole lot of attention on that. And I think, well, I know just as human beings are in general, we become our thoughts, right? And then if we're absorbing what other people think, those become our thoughts, and then we become that. And so you're inviting people to think outside of the traditional narrative, to think outside of what their assistants are being conditioned to believe about themselves and their roles, and there are other ways. So I absolutely love that, because I'm a huge advocate for empowerment, and so that's really cool that you're doing that work. Where along your journey did you really start to recognize, we can do more as a profession or as an assistant community? Or did you start to recognize it after you left working clinical and got into teaching and stuff like that, and really seeing the conditioning there? Or did you have a pivotal moment in your career where something shifted for you?
So I feel that, there's always things when you're working in the clinical side where you're like, well, I could jump in and polish here, but why aren't you letting me? Right? Like, I worked in ortho
Mm-hmm.
for such a long time. And the simple things, why can't I get a patient set up and polish their teeth before? And it's hygienists that put on the brackets in most ortho practices. Why can't I sit down and polish the teeth while you finish up there? Then you come over, sit down, patient's ready for you to go. Like, there was all these little things that just over the years, I think, were adding up. And then teaching, I really realized a lot of things because I loved teaching. This is where I'm like, I want to share my knowledge. This was like one of my most favorite jobs. Honest to God, I loved it because I wanted to help people learn and get out there. But then, so kind of maybe digressing a little bit here, but what I realized as well when I was teaching was that I could teach you everything that I know. The program is a year, and whatever's in the outline for the course. There's a couple of things in that. Everybody learns differently. Some people learn quicker than others. When I was in there, what I found was that, again, as far as some people picking up quicker than others, having these tests done midterm, the end of the year, was great, because again, you kind of, you have to see where everybody's at, and then all of a sudden they're free to go off. Was everybody ready to leave an environment that's controlled to go work solo on their own? Not always. I did a lot of things where I really tried to give them real life scenarios, as far as letting them come into the clinic and go, okay, everybody set up your chairs. I'd sit and I'd watch. I'd just watch the time, and I'd wait and I'd see what they do. And then I'm like, okay, when everybody's done, just step outside their units. And I said, you guys, sometimes it took them 20 minutes, half an hour. And I'm like, that's not realistic. I'm like, you can't do that in a practice. I said, take everything down, sign everything back in, like sign it back where it's supposed to be, and we're starting over, and I'm timing you. You have less than 5 minutes to turn over that unit. And because there's two of you in the chair, we don't need two people doing one job. You have to, number one, huge thing is communication. Communicate to one another. Say, okay, you go do this, you go do that. Instead of, oh, let's the two of us talk and put barriers on. It doesn't work that way. Let's the two of us walk over and sign out the instruments and make sure that everything is in the kit that we need. One person should be able to do that on their own, and the other person should be able to put the barriers on their own. So I timed them and I said, okay. And they all got panicked. I said, you feel the stress that you're feeling now? This is real life. You're going to have to do this on your own, and they're going to expect that you know these things when you leave here, right? So there was things like that. And it's about being clear and clear communication for, let's say, somebody new who's leaving a program when they're brought into a practice. And I don't think that that's always done. It's not always clearly communicated what they need to do. It's like, here, read this. This is your contract, or this is your, what you need to do. Here's the list of duties. Sign, sign, sign. Okay, you know what you're doing? Okay, let's go. Because the other assistant who's there might not have the time to be able to train them properly, because every doctor works differently. As much as everybody has their own systems within their practices or the way things flow, as much as they're the same, generally, people do things slightly different from here to there. Sterilization that should be a no-brainer. That's got to be like clean, clear cut, no matter what. We don't break, like, there's standards that need to be followed, this, and that. That's what you have to do. This is your patient's health and safety on the line here. And as far as instruments and the way the doctors work, it's different everywhere. I'm teaching you one thing on how to use, an instrument set for, let's say, crown and bridge or composite filling. Well, the doctor might not use everything that I've shown you here, but when you go out there, they just use what they like, what works for them, which is that's their prerogative. That's totally fine. And then there's even, when I left and I went out to how I ended up where I am now. There wasn't always clear communication when I left teaching with the position that I took after that. So again, it was just like, here, go do this. And I'm like, okay, well, this is your business. What do you want from me? And then it was just like, this is too much, or you're too much. You're asking too many questions. I don't know what to do. You should know what to do. And I'm thinking, this is a whole different realm over here for me, but I want to do my best for you. That's what I wanted. So there's, wherever you go, there has to be alignment. It has to fit for you. Some offices feel like family. And the biggest thing is that I'm finding is that a lot of people are just treating dental assisting jobs or their jobs as a job, not as a career. And that's the one thing I find. It's like, well, I don't like it here. I'm just going to go here. I don't like it here. I'm going to go here. And is it necessarily the person or is it the practice? Could be both, could be one or the other. Right. So again, we were bringing up before about, assistants are sometimes taken advantage of. They're overworked. They're underpaid. That's another huge thing. And again, this is where I say dental assistants have so much more to offer, I think. And there's so much more that encompasses that as far as individuals, the owner of the practice, who's the leader in the practice, are they actually communicating? Is it the doctor? Is it the office manager? Is the person that's coming into your practice actually getting proper training? Is there clarity? Are they actually understanding what you're telling them or what they need to know in order to succeed within your practice? Because that's what you want in order to have, a practice that doesn't have high turnover rates. What does that involve? It involves communication, clarity, training, and then being treated fairly. There's so much that's involved. And I never find that it's the same. I mean, I guess every area of dentistry has their thing, right? But when you look at it as a whole, the lowest person on the totem pole within the practice is essentially the assistant, and they're doing so much. And I'll give you this scenario, and I know I had kind of discussed this before, was coming out of dental assisting school, and I'll say this much, was being new. And this is where I say, and I had always let my students know, is that you're on your own. You're expected to do this. And the practice that I first worked in was a cute little practice. The doctor was great. The assistant who then went to work for the front desk, there was only four of us. It was a very small practice, but I was working, on my own by myself and, turning over the chairs. And I remember going into the back because I was cleaning up and having to get set up for my next patient. I go into the back to put my instruments down because the next patient's waiting. I've got to bring them in because it's just me. And I'm not, okay. And I have to precursor this because I'm not putting anybody down. I'm just saying one scenario that I had that was really awful for me as a new dental assistant was there are some really great hygienists that I've worked with. So I'm going to say that first. But in this practice, when I went into the back to bring my instruments, the hygienist had finished with her patient and she had left her instruments. And I look over and she's standing there eating her snack, reading the newspaper. And I was like, I need help right now. Like, and I looked at her and she didn't look at me. She just totally ignored me. And I had to leave everything. I needed some of those instruments for the patient after the one that I was going to be working on next, but there was nothing. And I went out and I said to the lady that was working at the front desk, I'm like, I really need help. Can you do? I mean, she was stuck working at the front. So she eventually had to jump in and help while the other one was sitting in the back, having her snack and reading her newspaper. And I thought, oh my God, this is awful. What am I getting myself into? And that's how I started my career. But I'm like, I plugged away. I didn't end up staying there very long. And then I ended up working in this other practice, which is where I was there for a long time. And that particular dentist really, really taught me so much. He was so great. He was always on top of technology. He was somebody I learned everything that I taught my students is what I learned from him because he was so particular and he was good. He was never, he was never somebody, he always says to me to this day, "Hey, Joanne, why did you leave me?" And I'm like, like, it's something where you want to get experience too in different areas of the field. So that's something that I wanted. And, I learned a lot from them. But there's just so much involved as far as dental assistants go. And it's where do you start? What do you do? What do you work on? Who do you talk to in the practice? Who's somebody that's I can really feel comfortable and not judged when I'm in there because I have a question to ask and you think that I should know it already when I might not. And that's okay because they should want you to succeed within your practice. So
Yeah. So for a dental assistant out there listening to this or watching this and they feel inspired, they feel a bit seen by what you're saying, and they want to make a change, right? They want to enhance their life in a way or make a difference in the trajectory of their career. What would you say is like the first step for them to take in trying to make a difference in their life?
within their practices. So if there's issues going on within their practice, it's again, who can you talk to that you can trust somebody that's going to go, "Okay, let's sit down and have a chat and go, what are you feeling? Is there any way that I can help you with this?" Some people might not feel that way. They just may be like, "Too bad, this is how it is. Keep going." If that's the case, maybe that's when you want to make a transition because again,
Mhm.
somewhere if the office is a place that's overall good and a place that you like working, then they're going to be willing to help you learn. And like I said, they want you to succeed. If it's too busy and too chaotic all the time and they're like, "Oh, I don't have time for this. I can't deal with this." How do you feel? That's not a place where I'm going to feel very comfortable working. So again, this is something I always said too, is that there are many other practices. I think sometimes you have to think, is the grass greener on the other side? Sometimes it is. Is the practice you're
Mhm.
working in doing things legit, right? Because there's a lot of places too that aren't always doing things the way they should. Would I want to work in a practice like that? No. I've heard some stories, even from my students when they went out on placements. I'm like, guys, I don't know that that's a place you want to be working in. You might want to reconsider your options. And they're like, but I can't. I'm like, there's options out there. There's a dentist on every corner, guys. Like, you can literally find another practice. So again, you want to be in a place that's going to want to help you expand, grow, and learn, right? Like that's something that I always say. So are there other options within the field? 100% there is. So if let's say working chairside isn't your thing, I hate to say it, as much as I love my dental assistants, there are other options within the field, right? Like I said, I went into teaching, but I was still working with dental assistants. And that's what I wanted because I wanted to share my experiences with the new and upcoming dental assistants and help them grow and know that there is so much and that you have so much to offer when you're out there because your patients become like your family. And that's the best feeling ever. And then even, that's what I'm going to tell you. Like as a dental assistant, this job can be so rewarding and so amazing if that's what you really want. And that's where I always say, why did you get into the field? What made you even get into this field? I know for me, I always wanted to help people. I always wanted to educate people. I always loved everything about, like I told you in the beginning, it was health and fitness somewhere along the way. And so on that note, I'll say being a dental assistant, you got to be on your toes all day. So if you can find time for yourself, I think that's important too, right? Again, there's just so much involved with being a dental assistant. It can be very demanding, very challenging. And I say there's a lot of I think you have to stay active in one way or another just because most of the time you're running all day between patients, between sitting for long periods of time or like I said I worked in ortho for many years. I'm on my feet most of the day running between it's an open clinic from chair to chair to chair helping this hygienist, going here to help the doctor, getting this patient, back then it was taking impressions, now it's scanning. But it's like all of these things, you're constantly on the go. If you're feeling sluggish, you're going to have a shit day, right? Like you want to make sure you're looking after yourself somehow. There's always a way. And I'll give you this quick example too was I've had students who when I was teaching, the only time that they had for themselves to get stuff done was in the morning. And that morning meant getting up at 4 o'clock in the morning. I had students who they couldn't always speak English very well. So you know what they did? They didn't use it as an excuse. What they did was they got up, they read the textbook, they translated whatever chapter module we were doing and then translated it back into English if it was an assignment, and I saw these students and a couple of them were just like, they were 90 students, like 90% averages in that class. But you know why? That's how bad they wanted it. And I think that's always the question is, how bad do you want it? Why are you in the field? Because when you're in something like this, like I said, you want to help your patients, you want to be in the healthcare field some way, and you'll find overall, because you're doing all of that and you enjoy what you're doing, it's going to be so much more rewarding in the end. And like I said, you see cases from the start to finish. I've seen cases where class 3 cases, they needed orthodontic surgery, and then they come back and I'm like, oh my God, you look awesome. Like, just to see the transition and be a part of that, seeing the patient difference in their whole demeanor and their confidence when they walk in after having, whatever it was done. It's freaking amazing.
Yeah, I love that. Well, gosh, Joanne, thank you so much. I just love how passionate you are about uplifting assistants and your own testimony and your journey, and seeing it, from all the sides, like your own journey coming in, being chairside for so many years, and then navigating into the teaching phase of assisting, which you get a whole different perception there. And you can really see the early stages of either confidence being built or confidence, being destroyed. And then also now making your way into coaching and consulting so that you can help assistants and you can help practices really maximize this community of dental professionals that are very often underutilized. And so I'm super grateful for the work that you're doing and advocating for folks that don't often get attention or the love that they certainly deserve. And I'm really grateful that you were on today. Thank you so much. This was really insightful for myself included, even though I knew everything, even though I totally agree with everything you're sharing. This was really helpful for me too. So thank you so much for being on.
Well, I thank you for having me because it gives every dental assistant out there a voice. And I think that's the most important thing is that you have a voice, you can use it if you use it appropriately, and just know that you are so valuable to a practice. And yeah, and again, I thank you for having me, Brandi. I think it's so great. I'm so happy to have connected with you and to be able to share my knowledge and my experiences here on your platform. So thank you so much for that. I really appreciate it.
You just listened to the real talk of dental. If it hit, if it stung, if it made you feel just a little more human, good. That's the point. This isn't about fixing practices, it's about healing people. And if you're brave enough to show up real in this industry, you're my kind of leader. Subscribe, call in, send your wildest workplace confession. And most importantly, don't clean up for anyone. The mess, that's where the magic lives. We'll see you again on the next episode.